Hi there, I'm Carolyn Zallmeyer, nurse practitioner from LowTE Florida, and I have the pleasure of having Dr. Derek Da Silva here to help explain this product, Prostate Control. It's one of our big sellers.
Yes.
From all over the country off our website. This one is just the go-to product.
Well, I'll tell you a very interesting story. I'm a Teak brother, which is Tau Kappa Epsilon, it's a fraternity from college. It's the largest national social fraternity, a little plug for Teak. But my big brother, who was in the fraternity with me, he called me about, 6 months ago and said, "Hey, Derek, got a little bit of issue going on. What can I do?" I told him, get a hold of this. I got a text from him the other day. It said, "Man, I am doing great. I'm not getting up at night anymore to use the bathroom. My PSA is improved because the swelling has come down." Folks, as we get older, our prostates, well, not everybody's.
Not mine.
Not everybody's, right? The men out there, their prostates enlarge. When the prostate enlarges, there's a tube that it impinges upon, and that's the reason that you get up at night, you don't empty your bladder properly, et cetera, et cetera. But for you who's doing so much hormones, this becomes an extremely important piece. Because in men, we want to make sure that testosterone is not converting to what is called dihydrotestosterone, because that's where the prostate swelling comes in, that's where the hair loss comes in, et cetera, et cetera. So what this does, along with pellets, and you don't have to be on pellets to use this. If you're a man over 40, you should be on this.
Absolutely. Yeah.
If you're over 40, you start taking this, take 2 at bedtime. That's all you need to do, because you're going to prevent some of the problems from happening. If you're on pellets, same thing. It will prevent the conversion of the testosterone to what is called dihydrotestosterone, which is where the problems begin. Now, what about women? Can women use this? Absolutely. Absolutely. We went through a whole discussion, and I know that you were involved in some of that discussion with my son as to should we change this name. But what we decided was, if we can explain to women, when Carolyn puts in a pellet in women and she puts in testosterone, there's a chance that can convert to a little bit of dihydrotestosterone. She may lose her hair. But the nice thing about what Carolyn does is that she starts low and goes slow. So the chances of that happening are very low. On top of that, she takes another precaution, which is using this.
Absolutely. The main ingredient is saw palmetto. Is
Saw
that correct?
palmetto,
Okay.
yes.
Great.
Saw
And
palmetto, Pygeum africanum, stinging nettles, pumpkin seed extract. These are all anti-inflammatories.
it sounds delicious.
They're actually anti-inflammatories that prevent the prostate from swelling. And that's really what you want to do. So men and women.
Yes.
Pelvic congestion syndrome. You know, you did GYN many moons ago, and this can be used for that also, because it reduces inflammation.
Beautiful, beautiful. Well, thank you so much for explaining our prostate control.
My pleasure.